Serena Rohr. I'm a registered nurse and the proud president of Oregon Federation of Nurses and Health Professionals. I'm joined today here by Helen Moss, a Kaiser patient for more than 30 years, Congresswoman Dr. Maxine Dexter, and my AFT president, Randy Weingarten. Nearly 4,000 Kaiser healthcare workers in Oregon and Southwest Washington have been on strike since Tuesday morning, and we will continue to be on strike until 7 a.m. on Sunday, October 19th. Kaiser says its mission is to keep the patient at the center of everything, but it seems they've lost their way, because the only center they appear to be focused on right now is their margin. Kaiser claims it can deliver affordable, high-quality care and be the best place to work through partnership with labor. But it's hard to believe that when more than 40,000 healthcare workers across the country are standing on strike lines and saying otherwise. We are part of the solution, and our proposals reflect that. Kaiser CEO Greg Adams earns more than $12 million a year, so it's difficult to accept that paying competitive wages to recruit and retain skilled healthcare workers is somehow unreasonable. Our bargaining teams representing nurses, lab professionals, social workers, therapists, mental health providers, physicians' assistants, and many more have been at the table for months, bringing forward real, evidence-based solutions for safer staffing, fair wages, improved patient access, and quality care. Labor has shown up, prepared, with data and solutions in hand, only to be met with blank stares, repeated questions that have already been answered, and very few meaningful counterproposals. We did not want to be on strike this week. No healthcare worker ever does. When Kaiser refuses to listen to the clinical expertise of the very healthcare professionals they hire to provide the care, highly skilled providers leave and patient outcomes suffer. And when Kaiser CEO refuses to settle fair and equitable contracts for all Kaiser employees, we have a responsibility to stand up for our patients and our professions and the future of quality health care. And standing up works. National management has agreed to return to the table October 22nd. And we hope Kaiser will come prepared this time with counterproposals that respect and honor both our patients and the care that we provide. And before I close, I just want to express my deep appreciation for all of the support we are receiving from our patients, our families, our elected leaders, and our community. Your solidarity fuels our resolve. Thank you. All right. Now, thank you, Helen, for speaking today. She's been a patient for 30 years of Kaiser.
Good morning. I'm happy to be here today. Actually, we've been patients for over 33 years and then a few in the Bay Area too. But, over the past 3 decades, we've had many reasons to get care at Kaiser facilities. And I can say without a doubt that it's the healthcare workers that have made our experiences with Kaiser good. In all our interactions with them, they have exhibited nothing but the highest level of talent, dedication, and commitment to their patients. Our most recent event was Monday, the day before the strike. My husband had scheduled surgery here at Sunnyside to repair a torn meniscus. He's out in the crowd cheering me on there. I cannot tell you how glad we were to get in before the strike. And to be cared for by the amazing healthcare workers in this facility. The physician's associate at the appointment before the surgery, the pre-op nurse, the post-op nurse, or the recovery room nurse. Everybody was amazing. Yes. All right. We do have a choice with our health care, and we pick Kaiser because of the workers. And we support the striking workers. They really are striking for what is fair and decent. And if Kaiser wants to keep good people, they have to give them competitive compensation. It's just like any other business. If they don't want to lose great workers to a competitor, they have to do what it takes to keep them. That means treating them with respect, letting them participate in decisions affecting patient care, and paying them what they deserve. These nurses and other healthcare workers and the people that support them show patients in so many ways why they are the best. Kaiser administrators and executives should get out of their office and witness the great care the healthcare workers provide to patients like my husband and me. Thank you.
Thank you so much. You know, she's right, y'all. My members give the absolute best care if you can get it. And now, Congresswoman Dr. Maxine Dexter.
Good morning. So good to see you all. I am Maxine Dexter. I'm a mother, a former Kaiser Permanente physician. I've worked with many of you, and it's so good to see you. And I am the proud Congresswoman for Oregon's 3rd Congressional District. I am here on the picket line today in solidarity with the Oregon Federation of Nurses and Health Professionals. Many of the professionals here today are people I've known and worked alongside for more than 15 years, taking care of some of the sickest patients in our region and some of the most challenging patients in the region. I've seen firsthand the vital work you do, supporting patients and families through some of the scariest times in their lives, holding their hands, stopping them from pulling out lines and tubes, protecting them and other staff when they are scared and lashing out, delivering exceptional care. And you do it under conditions that can take a real toll on your health and your mental health. And you show up every single day, and you do it again and again. I stand in solidarity with you today, tomorrow, and as long as necessary to make sure you get the fair contract with competitive benefits, fair scheduling, safe staffing, and the levels that you deserve to make it possible for you to continue to attract and retain the nurses that you need, the health professionals that you need, and to retain the quality of care that you are so proudly delivering every day. The health and safety of patients always comes first. I know that that has been your focus, your mission, day in, day out, even when you have sacrificed personally to make sure that those patients get the best care possible. Now, it's time for Kaiser to show how much they care about and prioritize your health and wellness, to show they respect you as professionals and care about your patients enough to make sure that you have what you need to not just have safety on the job, but to get the best people around you. The labor partnership is deeply meaningful at Kaiser. It's a part of the secret sauce that has kept us going for more than 75 years. We all know that healthcare is extremely challenging right now. The cuts and costs are crippling. We are all looking at an extraordinarily hard time, and it is time to stand up with you to make sure that you have what you need to get through these hard times so that our patients get what they need. All right, I'm having a hard time holding my dog and doing this. So sorry. All right, I'm just honored to stand in solidarity with you all. The remarkable clinicians who stood by me and our patients for so long. And going on strike, I know, is never an easy decision. None of you want to be out here. You all want to be taking care of your patients. But we know that when you stand up and fight for what you're worth, what you deserve, and what our patients deserve, everyone benefits. Our community is better. So thank you for taking that time and that risk for yourselves and for our community. It's time for Kaiser management to not just come back to the table, but to do what's right for our community, for you, and I stand with you, ready to stand in this fight. Thank you.
Thank you. You know, Congresswoman mentioned the challenges that we're facing right now, and I just want the community to know that we understand that, and our proposals reflect that as well. And now, our president, AFT President, Randy Weingarten.
Well, I'm glad to hear that after our rally yesterday, Kaiser has said that they are going to come back to the table. That's good news. But let's be real, that's because of all of you. That's because of all of you. And as Serena said last night, one day longer is one day stronger. I wish I had all of you in my classroom. I want to actually say first to Congresswoman Dexter, who's here both as a physician who understands Kaiser, but also as our Congresswoman. We support the righteous fight that you were making in Washington. They are trying to do, let's be clear, nobody wants a government shutdown. And all those workers who are working without pay, we want them working and paid fairly. And all those who were fired, I'm glad that labor took a lawsuit to get them back to work. They tried, by the way, to get rid of every single worker in the Department of Education that works for special needs children. That is just, but what the congressman is doing with her colleagues is they're saying that what that big bad bill broke in July, the huge Medicaid cuts, the basically taking away the tax credits so that Obamacare was remotely affordable. What they're saying is, you've got to fix that. You can't let people get all these premium statements and notices, 25 million, that are going to now have, premiums that are, twice, 3 times what they're paying right now. It's a fight for affordability. It's a fight for all of us. And I just wanted to say, as we are here with you, thank you for making that fight. Thank you for making that fight. And yesterday, we did cross out whose letter this was. This letter is familiar to all of you, right? But think about what happened because of your persistence, because of you being on the line. I said yesterday that this was, in this letter, and I'll say it in front of the cameras, a pack of lies. I'll give you one example. Mr. Adams attempted to convince you that you are better paid than anybody else in Portland. That's just not true. You're not even better paid than the frogs. You are, the truth is, because we have actually tried to make healthcare real in this metropolitan area, when they say you're better paid, you actually are below the market rate by 20%. So that's why our proposals are to get you to the market rate. Not to get you above the market rate, but to create the competition at the competitive wage so that Kaiser is not paying upwards of $250 million on travelers. Could you say that again? The truth is, one of the reasons that people live in the upper Northwest is because of fantastic quality of life. Or it was fantastic quality of life. And because of a sense that, and Kaiser, and the Congressman said it, that Kaiser made a deal, not a Faustian bargain. I know that's an SAT word. But they made a deal with the community and with its workers that basically said, we are going to have a different way of operating. We're going to operate understanding just how labor-intensive healthcare is. Healthcare is about what you do at the bedside. Healthcare is about a respiratory therapist helping an asthmatic person learn how to breathe again without devices. Healthcare is about what happens after surgery and being able to help a patient see hope later on, or a cancer patient. You know all this. That was what Kaiser said to all of its patients. We're going to have a different way. We're going to work with labor. We're going to figure this out together because we want to deliver the best health care. And Greg Adams has abandoned that value. And so part of what we are doing here by being on strike is we are saying to the community, no, we want that value. No, we want to do that. And this community expects it. I've been in Sunnyside. It expects it. It expects the best care because this community knows you. But how can you do that when we don't have enough staff? How can you do that when Kaiser is basically saying, if you need to be with patients for 30 minutes or for an hour, that you only have 15? You can't do it. And what it's doing is it's taking it out on your health, and it's taking it out on the patient's health, and you can't do this. So when we say this is a fight for the patients, this is a fight for you, this is a fight for the community, you know better than anyone else what our patients need and what our patients deserve. So exactly. And you have been there. I've had the honor of being your national president for 15 years. I've watched you. You've been there through thick and thin. What you're asking for, and I'm saying this now to the cameras, what these amazing healthcare workers are asking for is fairness. They put patients before their own health every single day. We are asking Kaiser to not abandon its promise to labor management relationships, to not abandon its promise to healthcare in the Northwest, but to sit down and to actually negotiate a fair contract. These folks have come in with problem-solving proposals. I know them. They are ingenious. They are creative. They know how to solve a problem, just like all of you do. We are saying to Kaiser, come back to the table next week with your working brain on, not with your abandoning, callous, robber baron brain on. Come back to the table wanting to make healthcare great in the Northwest. We are going to do that, and we will be out and doing that on the line and in the bargaining table, and if it takes another strike, we'll have to do that as well. But if they want to, I know you can make a deal for fairness, for our patients, and for our future. Thank you. Now I'm supposed to say, does the press have any questions? Right? That's what I'm supposed to say. I take my orders from Serena. Any? If not, one day longer.
One day stronger!
One day longer.
One day stronger!
And thank you so much, everyone. You are the heart of this community. Thank you.